Would I be a good candidate for CO2 laser? I'm 27 years old, half Asian, Filipina, half Caucasian. I've gotten 3 eMatrix treatments and 2 RF microneedling treatments within the past 2 years, with very little improvement. I'm looking for something more aggressive that'll give me better results. Would ablative CO2 be a good option? I still have mild acne. Thank you.
Thank you for your question. You're a 27-year-old woman, half Filipino and half Caucasian, with a history of acne scars, and you still have acne, and you've undergone, as you described in your question, 3 eMatrix treatments as well as 2 RF needling treatments, and you state you have had very little change and improvement. So you're asking if a more aggressive ablative CO2 laser is appropriate for you. Well, certainly I can understand your frustration. I'll give you a perspective based on my experience with acne scars. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. The use of lasers to help people with acne scars and actually treating acne scars with multiple different approaches is a significant part of my practice, and I can certainly appreciate the challenges that your doctors faced with your situation. You see, the treatment of acne scars is very often a treatment of trial and observation and then adjustment. When you look at what is the reason for acne scars, you understand what makes it challenging to treat. So the inflammation from cystic acne causes loss of tissue, loss of skin, loss of the top layer, loss of the middle layer, and even scar tissue underneath. So you end up with a variety of different types of scars called ice pick scars, boxcar scars, rolling scars. And it is certainly, there are plenty of successes with these technologies that you mentioned. The eMatrix is a fractional CO2 laser, and even the radiofrequency with the microneedling device can cause some tightening. Now, in my practice, I actually also suggest to patients to have a procedure called subcision, where I release the scar of the acne scars from the underlying tissue, and I'll use platelet-rich plasma in addition to try to stimulate collagen and stimulate the quality of the skin. One of the challenges is that the skin is, by definition, somewhat dysfunctional. And so what we use is platelet-rich plasma, and just to give you a little brief explanation, platelet-rich plasma is derived from your own blood. It's a concentration of the wound healing and growth factors. And I'll use platelet-rich plasma, I'll use hyaluronic acid filler to try to build up the tissue underneath so that the scar tissue fills, and then I will use a variety of technologies, including fractional CO2 laser, erbium, ND Yag. There are a lot of ways to combine these technologies. So I think that one of the challenges your doctors have faced is, of course, concern that in a young person who is prone to potentially hyperpigment or get pigmentary changes, they want to stay on the conservative side and be careful about managing the potential for hyperpigmentation. We have a particular laser made by a Fotona where we use erbium, which actually minimizes the amount of heat delivery, as well as ND Yag, which goes actually deeper under the tissue, and that's been kind of a good, safe option for us in comparison to the amount of heat delivery that we get with our Mixto fractional CO2 laser. You know, this is an art, and there is going to be a lot of people applying their technologies and methods in their own way based on their own experience. So I don't think you can necessarily throw away the technology that was used to help you and then go for something much more aggressive, because there is also a higher risk with treatments that are more aggressive, and this that you're probably still in a zone where you can do more without taking on that level of risk. You'll get a lot of suggestions by a lot of different people, and unfortunately for acne scar patients, they tend to bounce from doctor to doctor and get very frustrated. So I think that you should speak to the doctors that helped you with these original procedures. Ask about other options. See what they can offer you, because there may be more than just the laser devices that they can help you with. I always tell my patients with acne scars that you're not dealing with the situation where you're never going to see scars again. What you want to do is do the best you can to soften the appearance of the scars and not try to minimize them as a focal point on your face. And it is a challenge, and people who have cystic acne scars are unfortunately do feel that everyone is looking at their scars and feel like it really affects their self-esteem. As a general experience that I've had meeting a lot of these patients, a lot of people as they get older tend to feel like, they've always had them and they accept them, and they'll try to do something to help improve them. But I think that again, there is individual variation. So I would caution you about doing something much more aggressive. You may want to get additional opinions, but at the same time have a dialogue with the doctor or the doctors who helped you with the original procedures. So I can tell you that with fractional CO2 laser, you can go from minimal to very, very aggressive and everything in between. So you don't have to worry about the laser or the technologies not being strong enough. But there is information to be derived from your response, and you should probably take a look at your before and after pictures also. You may find that there are likely to be some subtle improvements that may not be so dramatic to you, but actually at the physically have come about from these interventions. So I hope that was helpful. I wish you the best of luck, and thank you for your question.